Hi, I hope everyone can hear me. It's Asim Jamil. How are you, everyone?
Yes, I can hear you.
Okay, so today our basic concern for this webinar is RCPI Pediatrics. I will give you a brief introduction about RCPI. Basically, I'm mentoring the sessions for the written examination 1 and 2. First, we will go with what is RCPI. Okay. RCPI Paediatrics is basically it's an entry exam for HST in Ireland, but it is fully recognized in UK, UAE, Singapore, India, Pakistan, and Bangladesh. Um, I have known a few persons basically who was working as a consultant in India, Pakistan, Bangladesh, and UAE also on alternate pathways. With the UK, basically, you can get a GMC registration with RCPI, and the important thing is you can get a job as ST3, but basically for the ST4, I think you just have to complete the RCPCH. It is really equivalent to RCPCH in one way because it can give you a registration with the GMC as well as you can work in Gulf countries and few other countries also. Please, I will say that if you have any question or something, just go on the chat box. Just let me know about it. Okay. So RCPI basically consists of two parts. It's RCPI part 1 and part 2. And part 2 is basically consists of two things, and that is a written examination and the clinical examination. Okay. So we will start from here, like how to create an account. I have just posted up all the link for the RCPI, so you can create an account there. It's basically the same way as we create an RCPCH account, and after the verification and the other things, basically they will let you know that now you can book up all the exams. Okay, and here is the email that basically if you have any queries or something, you can use this email and they will reply you. They're really good in that. Okay. Exam dates are always there. Exam dates are always there, but basically, someone has just asked me in chat, RCPA is basically an entry exam in Ireland. But basically, if you're coming from Pakistan, you have to get a IMC registration first, and then RCPI will definitely help you up to get all the essential things, especially uh, the BST and then the HST. For the HST, it's really an essential. So regarding our exam dates, it's always there, but the recent dates are for the RCPI Part 1, it is in the May, and for the RCPI Part 2, it is in August. No, I'm sorry. My slides, yeah. Okay. Regarding exam format, RCPA Part 1 basically consists of 100 MCQs in total, and I think the duration is 3 hours for the exam. It's basically it's very basic, not like the RCPCH1. It involves lots of pathology as well as pathophysiology and pharmacology, and there are a few also scenario-based questions. But I will say that again, it's basically really a very basic one. So you have to be more careful about it whenever you're choosing your options. And the important would be like you have to go through the basics also with the PEDS. Okay. Just an example for that. like you have a scenario for allergic rhinitis, and they will be asking you if you a treatment for that, like it is an oral is antihistamine as a treatment option. So Mm. the point will be like they will give you scenario like there's a mom who is sorry, there's a baby there who is basically presented with rhinitis, and there's a family history of allergic rhinitis, or in the same way like mom has the same kind of history, so what's your diagnosis, or they will ask you about what's your treatment. It's basically the simple one, but if you have like the query will be in a way if you have to choose oral antihistamine or just topical one, it depends on. Someone has just asked about HST. HST is basically heart specialty training. And if you're and the other question that was asked basically it was is RCPI is enough? Yes. If you're working in Ireland, basically they only recognize their RCPI, not the RCPCH. I mean, they will give you an edge in a way, like they will give you an edge in a way like you will be exempt from RCPI Part-1, but you have to go with the RCPI Part-2 along with the clinical for the registration from here, okay, as a RCPI. If you want to work, what you have to get is basically you have to get an IMC registration first, and then it will go with there, okay? If we are done with MRCPI, no, no. Someone had just asked question like if we have done MRCPI, then OET will be exempted. No, it's not like that. So just think about IMC, Irish Medical Council. It's a different entity, and the RCPI, it's really a different entity. First, you have to get an IMC first, and then you will be able to get your job as well as I think RCPI also. Okay, so let's proceed further. As I was telling you before, our CPI one is really a very basic one. So you have to go really completely with the basic steps of pediatrics. And there would be few scenarios also, but that will be really a very easy one to pick. And I would say that if you have a previous experience with the pediatrics, that's really very informative in a way, because you have a basic knowledge for the peds first, and then it will go on there. Okay. Lots of time, it was just asked in our group that what's the sources to consult for RCPI. So I would say that BMJ, it's the first one. You have to go completely with the BMJ, and then Illustrated Book of Pediatrics. For personal myself, I have just read two things, that was BMJ and Illustrated Book of Pediatrics. But I would say that if you want to ace really this exam, these things like BMJ, Illustrated Book of Pediatrics, and then the survival guide and HSE guideline, that will help you a lot to get your wanted score. I have just included the passing criteria here, and that's basically it's a percentile system, and it's basically decided by the RCPI, but usually it's above 55%. Um, I can answer your questions if you don't mind after this presentation. That will be really easier for me regarding our IMC and our RCPI. Is that okay? For the RCPI Part-2, that's basically our written exam. It consists of two parts. Part 1 is basically MCQ based, and it's in 80 MCQ, and Part 2 is basically 20 SEQ. With the MCQ part, that's basically really a basic part, but there are few advancements also. Basically, they are more focused in that way now with the scenario-based questions and regarding the diagnosis and first-line treatment. As Most of the people are really familiar with the AKP also. It's almost the same, but there are a few really different ways of doing RCPI Part 2. So the SEQ-based things are really very fundamental in passing your exam. Uh, I would go with the scenario that's really you will get it in BMJ also. The scenarios would be like that. Like I'm talking about RCPI 2 now. A baby with a cleft palate and retrogradia and laryngomalacia. The question was asked about which particular syndrome the consultant is looking for. So you see, if we have a cleft palate with retrogradia and laryngomalacia, the problem would be with the respiratory things. But the problem is, it's not a kind of simple one that he is asking about what kind of syndrome it is. But you see, the question was particularly the consultant is looking for, and the answer was basically the Stickler syndrome. So if we are really familiar with these kinds of real things, like someone has previous background with that, he can choose it up very easily. Uh, so as we got from our scenario, there was a retrognathia, there was cleft palate, and there was a respiratory distress. That was both from, I'm sorry, there was both from airway as well as brainstem abnormalities, the respiratory distress thing. The Stickler syndrome basically consists of one those things. So if you have really a good knowledge about these things, then you can choose it up easily. Otherwise, you will be stuck up a little. Okay, it's like that. With the SEQ part, I will go with this one. Like the question was about 7 years old male presented with deepening of voice and secondary sexual characteristics. So here, what you have to understand about is if the age is consistent with different things, like you have to think about, is it a precocious puberty or it's normal thing? So as we know that if with the male, if it's less than 9 years of age, we call it precocious puberty. See, so the diagnosis was about precocious puberty. Then the other question was what physical signs to confirm precocious puberty. So as we are all the doctors, and I hope so everyone has a previous background with the pediatrics also. So there are a few things that goes on with the precocious puberty. That's basically testicular size, length of and width of penis, and then hair axillary as well as genital and deepening of voice. So here in our scenario, it was like a really a very one line question, like 7 years old presented with deepening of voice and secondary sexual characteristic. It's giving you information in the form of like, yes, it is age is less than 9 years now. Okay, and there are sexual characteristics going on, so it means that it's a case of precocious puberty. Now, what could be the physical signs? So the physical signs, yes, we all know that it's a testicular size, and that's basically Germans. Then length of our scrotum, and then penile length, and then the third thing is axillary and hair, axillary and genital hairs. Okay, and the fourth one is deepening of voice. So that's how you have to answer all the questions. Otherwise, they will not check your questions if it's not in a particular format. So this is the only key to success in RCPI Part 2, especially in SCQ, is you have to go with the format, so that if they are going to check your paper, they will just give you a number. Otherwise, the problem would be like, if we write all those things but in a different way, like not in a particular way, they will not consider it. Like they will think that now he knows all the things, but the way he is describing things is really not so much convincing, so they will not give you a proper number. Okay, and the other was, so after that they will ask you about the causes. Okay, the causes for the precocious puberty, we know that it could be idiopathic, then go with neurofibromatosis, then septo-optic dysplasia, then obesity, and there are few syndromes like Pioneal-Bright syndrome, then the tumors, and the tumors could be central, testicular, adrenals, and the seventh one is CH. So when we are describing the causes, we have to go from central to peripheral and few syndromes that's associated with it so that they know that basically we have all the essential knowledge. We are just writing up our things in a way, in a proper way, so that whenever they're seeing our paper, they will give you a maximum marks. So the third thing they have asked about is the treatment. So what could be the treatment here? Look, if it's obesity or something, then we will go with the weight loss. It could be diet and exercise. And if it's a CNS tumor or something, then we will go with the GnRH analog. And definitely, what we have to do is we have to give them a little bit general treatment options as well as specific treatment options. Okay. And specific treatment could be if we're considering a tumor or something, that it could be surgery, radiotherapy, chemotherapy or something. Okay. And if it's like CAH or something, what we have to do is replace the missing steroids, replace glucocorticoid, mineralocorticoid, and what's causing the issues. We have to remove that. Okay. I'm sorry with my internet connection. Can everybody hear me? Hello?
Yes, sir, you are audible,
Yes.
sir. You are audible.
Oh, okay. Again, the sources here will be BMJ. Well, you all have to understand one thing, and that is basically BMJ is really a authentic book here in Ireland. I know that in RCPCH we use past test and all other recalls and everything, but in Ireland everyone is just using BMJ because that's really the authentic book here. Again, I'm saying a survival guide. I like that book very much because it gives you a basic information as well as treatment options and a diagnostic criteria also. So I would say that if you're going with the RCPI-2, definitely what you have to do is you have to go with this book. Okay, that's really well, all those persons who have really a background with the pediatrics, they can understand that the value of survival guide, I would say. And there are few recalls for the past papers. I would try to arrange that if I have, but I'm really not sure if we have those recalls because RCPI was not that much trending before, but now everyone is just going to get it because it's almost equivalent to RCPCH and it gives you a GMC registration also. Now, I would come to our questions so I can answer everyone. Okay. Um, Someone has just asked which is more useful. I would say that if you're working in UK, if you're thinking about working in UK, it can give you a registration for the GMC. You can secure a job, but if you're going on a training thing, okay, then the training would be basically is their requirement to go with RCPCH, completes RCPCH, and then you will proceed to ST4 and then whatever their way of training is. Um, Regarding outside the UK, yes, it is very useful because it is really recognized in the same way like RCPCH. Okay, and um, someone has just asked about sorry, someone has just asked about how to get an IMC. I would say that there are a few YouTube videos as well as you can go on IMC just to just know that how to register yourself. I was not really prepared for that. The IMC is really a different entity and the RCPI is really a different entity. So I'm not sure about it, but basically what you have to do is with the IMC, first you have to get your IELTS or OET, and it should be with the IELTS is basically 7.5, 7 in total, but 6.5 in each. And with the OET, it's a B in all the formats, so you can get your registration. And I'm from Pakistan, so I know that how to get an IMC from Pakistan, and that's basically you have to get PMDC certificate for house job recognition, and then it will help you up to get your IMC registration. Let's go down. Someone has just asked, as I have done my residency in pediatrics in 2020, am I eligible for MRCPI? Yes, definitely. The requirement is almost the same as it was for RCPCH, and that's basically you should have like 1 or 2 years of experience along with all other things. Okay, which one is more useful preparation for the exam part one, BMJ and past test? I would say that BMJ is really authentic book for RCPI. And with the past test, I know that you can get all your things from past tests, but the basic things are like they have few different guidelines with the UK, so you have to comply with that. Ireland guidelines seem like a UK guideline. Yes, it is almost the same, but there are few changes. These things are region-based things. Basically, the guidelines. It's not like RCPCH. Basically, they devise a guideline for their self, and RCPI and HSE they devise guidelines for their self. Number of attempts. Number of attempts, I think you can apply for 2 or 3 times. I'm not sure about it for the number of attempts basically, but I would really advise you just sit in your exam when you think that you're really capable of that, not just hate yourself. Okay. Preparation for MRCPCH1 and MRCPI1. It's almost the same things, but I would say that the basic issue is you have to go with the basics. Basically, pediatrics is almost the same everywhere, but the problem here is you have to be more careful with your choosing options. Someone has just asked, how early can we get a clinical? Well, I was working in HSC already, so I would say that I got it in just first 3 months. I think it is more easier to get clinical dates in RCPI than RCPCH. Someone has just asked, can't you work in Ireland if you have done MRCPCH and not MRCPI? No, it's not like that. As I told you that it is basically entry exam for HST, not for BST, not for standalone. It's a really different way. For working in Ireland, you just have to get an IMC first, and then you will get an interview for different hospitals. And if you got selected, you can work up there. But RCPI or RCPCH, it's not an essential, but definitely it will add you up for the job hunt. That's great. Any more questions? I'm really sorry if I have not replied to someone, but I tried to cover up things. Oh yeah, someone has just asked about which one is easy clinical examination. I would say that RCPI is comparatively easier than RCPCH. I think I have answered this question. RCPI is really easier than RCPCH. That's what my assumption is.
Assalamu alaikum, sir. I have put some questions in the chat box, but you are not answering them. Please, sir. Can you answer them?
Yes, sir. Yeah, please go on. I'm sorry if I have not answered that yet. Go on, please.
First of all, assalamu alaikum, sir, and thank you for this.
Walaikum assalam.
So basically, my question like BMJ and past test, because there's a lot of confusion among the candidates who are appearing. Like, is past
Yep.
test better or like BMJ? And what is like exactly BMJ? We are all new. We don't know. Like, is it a book or a subscription?
No, it's like a past test subscription. It's the same way the MCQs are devised, but BMJ is basically always getting updated, always. So that's why it is more valuable. And RCPI basically depends on BMJ also. So I would say that for myself, I have just studied that BMJ, the subscription.
There is BMG, matlab for pediatrics, BMG, MRCPI Paediatrics there, sir. Like
Yes,
specific for.
yeah. Yeah, it's for specifically for the peds. Basically, RCPI is going on like MRCP, for the medicine. But if you go on for subscription, it will give you options for peds also, and
Oh,
that's really a different entity. Yeah.
thank you, sir. Because we was confusing. We were searching in the Google. It's not showing MRCPI, BMG Pediatrics. So in short, we will find it,
No,
sir.
it will
Thank
be
you.
BMJ online first. You will get a subscription there, and then it will give you an option like if you're working in adult medicine, cardiology, and pediatrics like that.
And sir, second question is OET necessary for like OET or IELTS? Is it necessary for the like for examination, or it's only necessary for the registration? After examination, we can do that part, sir. Is it okay?
Yeah, yeah. Well, for the examination purpose, basically like RCPCH, it is you just have to create your account. Okay, OET is not essential for that, but basically for Irish Medical Council registration for working in Ireland, okay, OET is essential.
So sir, like we can pass the exam first, all the three parts, then we can go for OET and all. Is it right, sir?
Um, well, I just have to check in one way because I think for the clinical, basically, there are a few centers there, not like RCPCH. It's only in Ireland or in few other countries. I
And
don't
for
think so that OET is needed for that because they have not asked me before for the proof of OET or anything at all for the clinical exam also.
thank you. So that was the confusion because we are like whether we should go do OET first or we should go with the exam first, finish the exam and then go for OET for registration. That was the basic confusion we have like that.
I would say that OET is really not essential because I went through all the registration and every purpose for the exams. Basically, they have not asked about. But yes, someone has just asked me another question before. I'm not sure like who was there that if we can go with the MRCPI 2 first and then MRCPI 1. No, it's not like that. Basically, you will pass your MRCPI Part 1 first and then you will go with the Part 2 because that's how they work. It's not like RCPCH. And no, it's not essential. OET is not essential for that. But uh, if you want to work in Ireland, then the other path will apply.
Thank you, sir. Thank you for
Okay,
the.
you're welcome. No worries. No worries. Um, no, BMJ is like BMJ is basically for the pediatrics. It's not like an RCPI thing as all at all. Uh, Someone has just asked about if I will continue to MRCPCH or RCPI. Basically, it's your choice, I would say that, but RCPA is comparatively easier and you can get your clinical dates very early. So you can get your degree earlier, I would say. Someone has just asked about how long would it take for an FCPS PEDS past candidate to clear. For myself, I just cleared it in the row, like six or 7 months. First I got my registration, I got my RCPI 1, then RCPI 2, and then clinical. And it was just a 6 months, I would say, because the way they basically behave is if you are working here and you're sure like you can pass your Part-1, then you can book your Part-2 before the results. And if you have passed your exam already, then they will proceed like pay to RCPI and they will give you a slot. So it was easier for me just to go with all those things in 6 months. Okay. Someone has just asked about, sir, what would you suggest? You suggest we should do MRCPC first or MRCPA? No, it is not on myself. Basically, it's on yourself, whatever you want. For RCPI, I would say that basically you can get your all things easily and earlier than RCPCH. If you're working in UK, so it's easier for you to just get the slots for clinical. But if you're working outside the UK, it could be a little bit difficult. Yes, I would say that yes, you can get your GMC with the RCPI, yes, and you can get your ST3 training. ST3 job. Not familiar with lots of things, but that's what a few people have done with the RCPI. Any more questions? Okay.
I have one question, Doctor.
Please go on.
First of all, thank you so very much for arranging this session. This is very informative, and it's
No
quite.
worries at all.
I got all information. We are clear with part FCPS Pediatrics, and I think the part 1 is exempted, isn't it?
Yes, yeah, that's true. If you have completed your FCPS, yes, part 1 is exempted. And if you have completed your MRCPCH, then still part 1 is exempted. But part 2, you have to go with.
Okay, so still we have to fill the form, and then we have to attach the degrees, sign up the
Yeah,
account, attach the degree, and put on there. And
yes,
yes.
yeah, yeah, that's true. Yes, I know it's a little bit hustle, but yes, you have to do it basically.
Thank you so much. And are there any suggested and proposed online courses for the part 2 preparation? If we need details, then
Uh, well, we will conduct our few sessions for the written exam. Yeah, for the RCPI part 2.
okay. Thank you so much.
You're
Thank
welcome.
you.
Someone has just asked about part 2 MRCPA theory books. I would again go with the BMJ as well as survival guide. Survival guide is really good in a way because it gives you information about how to diagnose a scenario as well as give you a treatment options also. So that's what basically would be asked in RCPI to SCQs. No, MRCPI doesn't charge any fee for the exam for the account making. Yeah. Okay. Uh, First you have to get your BMJ subscription. Okay. Then you will go with the pediatrics section. Then it will go on from there. Okay. And it's basically not for RCPA specific thing. It is basically scenario based things. It will give you information in the form of how the scenarios are, what's the initial diagnostic test, what's the final diagnostic tests, okay, and what's the explanation. Yeah. Give about question bank we should use for MRCPI. BMJ. Yes, it is like a pass test. Yeah. It's the same for AKPTS and FOP. Well, the point is what you have to understand all the people is basically the pediatrics basic knowledge. It's the same. So the question could be different, but it basically depends on yourself. Like how do you select things? Okay. Will AKP be helpful? um, Look, as much as your knowledge, you have a basic knowledge, yes, it's helpful, and definitely, yeah, it will help. Yep. Especially on MCQ based things, yes, it will help, but I'm not sure about SEQ because SEQs are really different. As I was explaining to you before, it is like they will ask you about the diagnosis, then they will ask you about the causes, then they will ask you about um, uh, the diagnostic tests, and they will ask you about treatment options. It's like that. Yeah. For RCPI Part 2 SEQ. My friend, it's not like a book. That's what I'm telling you. Basically, RCPI doesn't have a recall things or other things at all in a particular way. That's why basically what you have to do is you have to go with the basic knowledge as well as clinical things, and then you can decide, yes, this was my scenario. This is the answer. Then this is the causes, and this was the treatment options. Yeah. I don't think so. That is there any hard copy there for RCPI? Yes, we will start from 9th of March. Is that okay? I hope I've covered few things, but if you have any queries or something, you can contact to our MedPrep Online, and they will let me know, and we will go from there. Is that okay? Um, I want to just ask about passing percentage. So, well, it's basically decided by RCPIs. It's a percentile system, and it depends on the exam as it is for RCPCH. But usually it's between 55 to 60%, and sometimes 62 or 63%. It depends on basically. I can't comment on this thing. All right. Take care, everyone. Enjoy your evening, okay? And really, if you have any question or something, you can contact us again. Is the clinical part difficult? Well, it is basically, it's format-based things, you know that already, but I will share the link for BMJ subscription, okay? Then you will get it from there, okay? Yes, RCPCH people, they also use that. It's basically updated version of everything. It's not no, it's not a separate thing at all. Yeah. But yeah, definitely. We will share the link. Yeah, not to worry about from that point of view. Yeah. Okay, that's great. It's nice to have you all. Just take care, everyone, and see you. Take care. Bye bye.